Hi, my name is Dr. Dan Maroney, and today we're going to talk about the thyroid. A couple things real quick regarding the thyroid. Probably one of the most misdiagnosed and mistreated conditions that I see in practice every day. And there are a couple reasons for that. We'll talk a little bit about those reasons. Uh, what I want to talk to you about initially is this. This video is specifically designed for a specific type of patient. That patient is the patient that has been diagnosed with a thyroid condition, has been placed on thyroid medication, and maybe in the beginning the medications worked a bit to control the symptoms, but overall it doesn't really feel like the medication is doing much, meaning either the symptoms never went away or they returned. And matter of fact, I've had patients tell me quite consistently that, you know what, it doesn't even matter if I take the medications. My symptoms are still the same with or without. If that is you, okay, been diagnosed, been on medications, and even your lab values are normal, but yet you still have the thyroid symptoms, and I'll talk about those in just a second, this video is actually for you. So real quick, let's talk about it. You have thyroid symptoms: fatigue, morning headaches that wear off as the day progresses, depression, constipation, hypersensitivity to cold, poor circulation, so you'll have numbness in the hands and feet, perhaps. Muscle cramps are very common, especially at rest, not so much with movement, but at rest, and a lot of times at night. Decreased immune function, so you're susceptible to getting sick quite often. Sleep, you need more and more sleep in order to function. Poor digestion, we often see digestive disturbances with low thyroid conditions. Itchy, dry skin, dry, brittle hair, hair falls out easily, etc. Just wanted to list some so you could identify with those symptoms if you do have a thyroid condition. Okay, the big picture, the big idea of this video, if that is you, symptoms, medication, and the medication has not done much for your symptoms, then you more than likely, and listen to me closely here, you more than likely don't have a thyroid problem. And you're probably going to go, what? My labs told me. Well, the reality is that most of you may have something called Hashimoto's thyroiditis. I'd say many of you, maybe not most of you, but many of you may have something called Hashimoto's thyroiditis, or you have another pattern of thyroid dysfunction that either of those two things that I've mentioned are not true thyroid problems. Let's start with Hashimoto's real quick. Hashimoto's is actually an autoimmune condition that affects the thyroid. So basically your immune system kind of went haywire on you. Not going to get into why and how and all that right now, but let's just for intent and purposes say that your immune system is attacking your thyroid gland, okay? And that attack is destroying thyroid tissue, which is causing the symptoms that you're having. So the big point I want to make is that it's not a true thyroid problem. The thyroid is the secondary or the result of the problem, where the immune system attack is the primary problem. Okay, I can't emphasize that enough because it's never treated like that, and that's where you're going to find major discrepancies. It's not treated as an immune system problem, and it absolutely 100% has to be. Matter of fact, I've never seen it as an immune system problem, yet the studies, the references are there like you wouldn't believe. The physiology, everything is there. It's just not treated that way. Don't ask me why, it's just not. We do, however. But, okay, so if you're not Hashimoto's, then there are, roughly speaking, 6 other patterns of thyroid dysfunction. One of those patterns is an actual thyroid problem. And I'll keep it as simple as that, which, if you take medication, you should be fine. The other patterns, though, are very similar to Hashimoto's, meaning it's not a thyroid problem. There are other problems going on in your body that are causing certain issues, okay? And not to get into it too deeply with biochemistry, but you know, when you're making thyroid hormone, that thyroid hormone then has to be turned into T3, and then it has to be converted. There's a lot of processes that go on there. You could have a problem with the pituitary gland, you could have a problem with converting T4 to T3, you could have a problem with thyroid binding globulin. Again, not to get into it too heavy. My point is that those problems, if you have a problem with just something briefly that I just mentioned, you're going to have an overall thyroid issue. But again, if you're the candidate or the patient that's listening to this that has been on medication and you don't feel like the medication is doing anything, meaning your symptoms are still there, you either have Hashimoto's or one of the other 5 thyroid patterns of dysfunction. Okay? If you're taking medication, you're listening to this, and you feel great, then you probably just have an underactive thyroid, which is an actual thyroid condition. The rest of you, more than likely, don't have that. Okay? So, a couple other big problems. The testing, the lab testing, in order to properly find out what pattern of dysfunction you have, or if you have Hashimoto's disease, is, I can't emphasize this point enough, is critical. Okay, and one of the biggest mistakes that I routinely see in healthcare is they only test, most healthcare providers only test TSH, thyroid stimulating hormone, and T4. And those 2 markers are not near enough information in order to correctly tell if you have Hashimoto's and if you have one of the other patterns of dysfunction. There are about 7 other markers, okay, that absolutely have to be tested in order to find out which pattern you have. Here's the bigger kicker for you, and unfortunately you're up against a mountain here. No matter what markers are tested, most healthcare providers are going to prescribe a thyroid hormone like Synthroid or levothyroxine or Armour, which is a better option in my opinion. However, the point being is that number one, you need to know how to what lab tests to look for. Okay. Number 2, you need to know how to treat it once those lab tests are found. I haven't found a healthcare provider, whether that's MD, naturopath, homeopathic doctor, doesn't matter. I have not found one healthcare provider that does not treat it with a synthetic hormone or even a natural hormone like Armour, even if those other patterns are found. It's just not done in the healthcare profession, but that's why you're suffering, because your problem, okay, and I've said this 5 times already, is probably not a thyroid problem. It's a problem going on elsewhere that's causing the thyroid to malfunction. So if that's the case and you're taking thyroid medication and you still have a problem elsewhere, I think you can surmise you're not going to get better. The problem is never fixed. And that's what has to be done. Okay? So I hope I didn't confuse you. I hope that was very, very clear. I'm actually going to show you a book right now that I want you to really consider getting. Okay? This book is called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? Okay? The book is written by a doctor named Datis Karazian. Okay? In my opinion, this is the expert on thyroids or thyroid conditions. And I would recommend highly getting this book. I have my patients read at least the first 3 chapters, if not more, of this book. I have them view this video because I want them to understand A, how we're different, but B, why they haven't gotten better. Okay? This book, filled with a ton of references, almost every one of them I've actually looked up myself, looked at the science behind it, looked at the literature. I'm telling you folks, this is the answer. If you're still suffering on medications but the lab values are normal, you have something else going on in your body, but yet it's being treated as a thyroid problem. Okay? If you need answers, call us, 714-241-9355. You can ask for me or you can ask for Terry, and she'll help you direct to me. And what we can do is either answer your questions, okay, or we can get you in for an exam where we can review all your data, all the materials, all diagnostic studies that you've had, your history, etc., and start trying to find out which pattern of thyroid dysfunction you have. Again, if you're on medication, symptoms just haven't gotten better, this is the candidate or patient that we're really talking about. Okay? I wish you the best. Good luck, and any questions, definitely direct them to me. Okay? Thank you.